Rheumatoid arthritis, often referred to as RA, is a chronic autoimmune condition that primarily affects the joints. Early detection is crucial because timely intervention can help slow disease progression and improve quality of life. In this video, we'll explore the early warning signs of rheumatoid arthritis, helping you recognize symptoms before they become severe. Understanding these early indicators can empower you or your loved ones to seek medical advice sooner, potentially making a significant difference in long-term joint health and overall well-being. Let's begin by looking at what RA is and why early recognition matters. Rheumatoid arthritis is an autoimmune disorder, which means the body's immune system mistakenly attacks its own tissues, especially the lining of the joints. This leads to inflammation, pain, and eventually joint damage, if left untreated. Unlike osteoarthritis, which is caused by wear and tear, RA can affect people of any age and often starts subtly. Recognizing the difference between RA and other joint issues is essential for early management. Now, let's move on to the first signs you might notice if RA is developing. One of the earliest and most common warning signs of rheumatoid arthritis is joint stiffness. This stiffness is usually most noticeable in the morning or after periods of inactivity, such as sitting for a long time. Unlike the brief stiffness that can occur with aging or overuse, RA-related stiffness often lasts for an hour or more. It can affect any joint, but it's most commonly felt in the smaller joints of the hands and feet. If you notice persistent stiffness that doesn't quickly resolve, it may be time to pay closer attention to your joint health. Another early sign of RA is swelling in the joints. This swelling is caused by inflammation and can make the joints appear puffy or larger than usual. The swelling is often accompanied by tenderness and warmth in the affected area. It may start in just one or two joints and gradually spread to others over time. Swelling that persists for weeks, especially when combined with other symptoms, should not be ignored. Early intervention can help prevent long-term joint damage. Persistent joint pain is a hallmark of rheumatoid arthritis. This pain is often described as aching or throbbing and can be mild at first, gradually becoming more intense. It typically affects both sides of the body equally, such as both wrists or both knees. The pain may worsen with movement or after periods of rest. If you experience ongoing joint pain that doesn't improve with rest or over-the-counter medications, it's important to consider RA as a possible cause. Inflamed joints in RA often become red and feel warm to the touch. This is due to increased blood flow in response to inflammation. Redness and warmth are usually most noticeable in the smaller joints, such as those in the fingers and toes. While these symptoms can also occur with infections or injuries, their presence alongside other RA signs should raise suspicion. Monitoring these changes can help you track the progression of symptoms and provide valuable information to your healthcare provider. Fatigue is a less obvious but very common early symptom of rheumatoid arthritis. People with RA often feel unusually tired, even after a full night's sleep. This fatigue can be overwhelming and may precede joint symptoms by weeks or months. It can affect daily activities, concentration, and mood. If you find yourself feeling persistently exhausted without a clear reason, especially in combination with joint discomfort, it could be an early warning sign of RA. Some people with early RA experience a low-grade fever. This mild increase in body temperature is a result of the body's immune response to inflammation. While fever is not always present, its occurrence alongside joint pain, swelling, and fatigue can be a clue that something more than a simple infection is going on. Persistent low-grade fever should be discussed with a healthcare professional, especially if other RA symptoms are present. Loss of appetite can also be an early sign of rheumatoid arthritis. Chronic inflammation can affect the body's metabolism and reduce the desire to eat. Over time, this may lead to unintended weight loss. If you notice a decrease in appetite that persists for several weeks, especially in combination with other symptoms like fatigue and joint pain, it's worth considering RA as a possible cause. Unintentional weight loss is sometimes seen in the early stages of RA. This is often due to a combination of reduced appetite and the body's increased energy use from chronic inflammation. While weight loss can have many causes, when it occurs alongside joint symptoms and fatigue, it may point toward an underlying autoimmune process, like RA. Keeping track of your weight and discussing any unexplained changes with your doctor is important. Some people with early RA may notice numbness or tingling in their hands or feet. This can occur when inflammation in the joints compresses nearby nerves, leading to sensations similar to pins and needles. These symptoms are often more noticeable in the morning or after periods of inactivity. Persistent numbness or tingling, especially when combined with other joint symptoms, should be evaluated by a healthcare provider. As RA progresses, you may notice a decreased range of motion in affected joints. This means it becomes harder to fully bend or straighten the joint. Early on, this limitation may be subtle, but over time, it can interfere with daily activities like gripping objects or walking. If you find it increasingly difficult to move your joints as freely as before, it could be an early sign of RA. Rheumatoid arthritis often starts in the small joints of the hands and feet. You may notice swelling, pain, or stiffness in your fingers, knuckles, or toes before larger joints are affected. This pattern of small joint involvement is a key feature that helps distinguish RA from other types of arthritis. Paying attention to changes in these areas can provide important clues for early diagnosis. A classic feature of RA is that symptoms tend to occur symmetrically, meaning both sides of the body are affected in a similar way. For example, if you have pain or swelling in one wrist, you're likely to experience it in the other wrist as well. This symmetry helps differentiate RA from other joint conditions and is an important detail to mention to your doctor. Early in the course of RA, symptoms may come and go. You might experience periods of increased joint pain, swelling, and fatigue, followed by times when symptoms improve or disappear. These episodes are known as flare-ups. Keeping track of when and how often these flares occur can help your doctor determine the best course of treatment and monitor disease activity. As joint pain and stiffness increase, you may find it harder to perform everyday activities. Simple tasks like buttoning a shirt, opening jars, or walking upstairs can become challenging. Early recognition of these difficulties can prompt you to seek medical advice and start treatment sooner, potentially preventing further joint damage. Morning symptoms are particularly characteristic of RA. Many people find that their joints are stiffest and most painful right after waking up. This morning, discomfort can last for an hour or more, making it difficult to start the day. If you notice that your symptoms are worse in the morning and gradually improve as you move around, it's a strong indicator of inflammatory arthritis like RA. In some cases, early RA can cause subtle changes in the shape of the joints. You might notice slight deviations in your fingers or toes, or a change in the way your hands look. These early deformities are usually mild, but can progress over time if the disease is not managed. Early detection and treatment are key to preventing permanent joint changes. Some people with RA may notice changes in the skin over affected joints. This can include redness, warmth, or even the appearance of small lumps called rheumatoid nodules. These nodules are firm bumps that develop under the skin, usually near joints. While not everyone with RA develops nodules, their presence can be a sign of more active disease. RA can sometimes affect the eyes, causing symptoms like dryness, redness, or pain. Inflammation of the eyes, known as episcleritis or scleritis, can occur early in the disease. If you experience persistent eye discomfort along with joint symptoms, it's important to mention this to your doctor, as eye involvement may require special treatment. Dryness of the mouth is another possible early symptom of RA. This can occur when inflammation affects the glands that produce saliva. Persistent dry mouth can increase the risk of dental problems and discomfort. If you notice this symptom along with joint issues, it may be related to RA or another autoimmune condition. Chronic inflammation in RA can lead to mild anemia, which means a lower than normal number of red blood cells. This can cause symptoms like fatigue, weakness, and pale skin. Anemia is often detected through blood tests, so if you have unexplained fatigue and other RA symptoms, your doctor may check for this condition. Even before obvious joint symptoms appear, RA can cause low-grade inflammation throughout the body. This may manifest as a general feeling of being unwell, mild fever, or subtle aches and pains. Blood tests may show elevated markers of inflammation, such as ESR or CRP. Recognizing these early, non-specific signs can help prompt further investigation. A family history of rheumatoid arthritis or other autoimmune diseases can increase your risk of developing RA. If you have close relatives with RA, it's important to be especially vigilant for early symptoms. Sharing this information with your healthcare provider can help guide early screening and diagnosis. Certain blood tests can provide early clues to the presence of RA. These include tests for rheumatoid factor, RF, anti-CCP antibodies, and markers of inflammation like ESR and CRP. While not everyone with RA will have positive results, these tests can support a diagnosis when combined with clinical symptoms. Early imaging studies, such as X-rays, ultrasound, or MRI, can sometimes detect subtle joint changes before they are visible on physical exam. These imaging techniques can reveal inflammation, fluid buildup, or early erosions in the joints. If your doctor suspects RA, they may recommend imaging to help confirm the diagnosis and assess the extent of joint involvement. Because early RA symptoms can mimic other conditions, such as viral infections or other types of arthritis, misdiagnosis is possible. It's important to keep track of your symptoms and communicate any changes to your healthcare provider. A thorough evaluation, including physical exam, blood tests, and imaging, can help ensure an accurate diagnosis. The early symptoms of RA can take an emotional toll, leading to feelings of frustration, anxiety, or sadness. Coping with persistent pain and uncertainty about the future can be challenging. Seeking support from friends, family, or mental health professionals can help you manage the emotional aspects of living with a chronic condition. If you notice persistent joint pain, swelling, stiffness, or other symptoms discussed in this video, it's important to consult a healthcare professional. Early evaluation and diagnosis can lead to better outcomes and may prevent irreversible joint damage. Don't wait for symptoms to become severe before seeking help. Keeping a symptom diary can be a valuable tool in identifying patterns and triggers for your symptoms. Note when symptoms occur, their severity, and any factors that seem to make them better or worse. This information can help your doctor make a more accurate diagnosis and tailor treatment to your needs. Making small changes to your daily routine can help manage early RA symptoms. This might include gentle exercise, using assistive devices, or modifying activities to reduce joint strain. Adopting a healthy lifestyle, including a balanced diet and adequate rest, can also support overall well-being and joint health. Starting treatment early in the course of RA can make a significant difference in long-term outcomes. Medications can help control inflammation, relieve symptoms, and prevent joint damage. The sooner RA is diagnosed and managed, the better the chances of maintaining joint function and quality of life. A rheumatologist is a specialist in diagnosing and treating arthritis and related conditions. If your primary care doctor suspects RA, they may refer you to a rheumatologist for further evaluation. These specialists have the expertise to confirm the diagnosis and develop a personalized treatment plan. There are several types of medications used to treat RA, including nonsteroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and disease-modifying antirheumatic drugs, DMARDs. These medications work in different ways to reduce inflammation and slow disease progression. Your doctor will choose the best options based on your specific symptoms and needs. Physical therapy can play an important role in managing RA symptoms. A physical therapist can teach you exercises to maintain joint flexibility, strengthen muscles, and reduce pain. Early involvement in physical therapy can help preserve joint function and improve your ability to perform daily activities. In addition to medical treatment, self-care strategies can help you manage early RA symptoms. This includes pacing yourself, using heat or cold packs, and practicing stress reduction techniques. Listening to your body and making adjustments as needed can help you stay active and comfortable. Connecting with others who have RA can provide valuable support and encouragement. Support groups, both in person and online, offer a space to share experiences, learn coping strategies, and find emotional support. Building a strong support network can make it easier to manage the challenges of living with RA. Regular follow-up with your healthcare provider is important for monitoring the progression of RA and adjusting treatment as needed. Your doctor may use physical exams, blood tests, and imaging studies to track disease activity and ensure that your treatment plan remains effective. The main goal of early RA treatment is to prevent irreversible joint damage. By controlling inflammation and addressing symptoms early, you can reduce the risk of deformity and maintain joint function. Staying proactive and following your treatment plan are key to protecting your joints for the long term. With early recognition and proper management, many people with RA are able to lead active, fulfilling lives. Staying informed, working closely with your healthcare team, and making healthy lifestyle choices can help you manage symptoms and maintain your quality of life. To recap, the early warning signs of rheumatoid arthritis include joint stiffness, swelling, pain, redness, fatigue, low-grade fever, loss of appetite, mild weight loss, numbness, and decreased range of motion. Recognizing these symptoms early and seeking medical advice can make a significant difference in managing the disease and preserving joint health. The most important takeaway is that early detection and intervention are crucial in rheumatoid arthritis. If you or someone you know is experiencing persistent joint symptoms, don't hesitate to reach out to a healthcare professional. Early action can help control the disease, prevent joint damage, and improve long-term outcomes. There are many resources available for people living with RA, including patient organizations, online forums, and educational materials. These resources can provide information, support, and practical tips for managing symptoms and navigating daily life with RA. Remember, you are not alone in facing rheumatoid arthritis. With early recognition, proper treatment, and a supportive network, it is possible to manage symptoms and maintain a good quality of life. Stay proactive, stay informed, and take care of your health. Thank you for watching this overview of the early warning signs of rheumatoid arthritis. By staying alert to these symptoms and seeking timely medical advice, you can take important steps toward protecting your joint health and overall well-being. Wishing you good health and strength on your journey.